How to Avoid Pregnancy by Monica Cerda and Jesse Gomez. We will begin by defining pregnancy. Pregnancy is a period of 40 weeks in which a woman carries a fetus in her uterus. Statistics of pregnancy. In 2008, 51% of 6.6 million pregnancies were unintended. Of those unintended pregnancies, women between the age of 18 and 24 years had the highest rate. Most of these women were of low income and of racial minority. According to William Yarber, sexually active couples have an 85% chance of becoming pregnant if no method of contraception is used. In the United States, about half of all pregnancies are unintended. What are some reasons some women don't want to have children? Having children can be stressful. Children are expensive. Some women don't like children. Others like having the freedom to do what they want. Some aren't able to take the time off from work. The choice to have children varies from person to person. Men and women can prevent unwanted pregnancies through the use of contraception. Contraception is the use of artificial methods or techniques to prevent pregnancies. Some of the major forms of contraception include hormonal methods like the pill, patch, or shot, or barrier methods such as condoms and diaphragm. It is important that a person chooses a method of contraception that works best for them. The first method of birth control is the practice of abstinence. Abstinence is the absence of genital contact that can lead to pregnancy. Abstinence is the most effective method in pregnancy prevention. Hormonal methods of birth control contain synthetic hormones like estrogen or progestin that prevent ovulation, thicken cervix mucus so that it's harder for the sperm to reach the egg, and thin the lining of the uterus so that a fertilized egg does not implant itself on the uterine wall. Birth control pill is a popular hormonal method. It is an oral contraceptive that is 99.7% effective when used correctly. Its advantage includes regulated and lighter periods, fewer PMS symptoms, and often help reduce acne. The disadvantage includes nausea, vomiting, and mood swings. Next, the Depo-Provera shot is an injection of progestin that prevents pregnancies for 12 weeks. It is 99.8% effective when used correctly. The shot eliminates having to remember to take a pill daily and is shown to prevent cancer of the uterus. Unfortunately, the shot may cause irregular periods, depression, weight gain. The patch works similar to the pill. It is attached to the skin, changed 3 times per month. It is 99% effective and has shown to treat acne, prevent cysts, and regulate periods. Many women have experienced mild skin reaction due to the adhesive. Others may experience breast tenderness, nausea, and vomiting. Barrier methods are a form of contraception that act as a barrier to prevent sperm from reaching the ovum. Barrier methods include condoms, both male and female, sponge diaphragm, and cervical caps. The male condom is flexible, sheath of latex that fits over the penis. It has a reservoir tip that allows room for ejaculation. When used correctly, the condom can be 98% effective at pregnancy prevention and can also prevent the spread of STIs. The female condom is inserted vaginally and works similar to the male condom by preventing sperm from entering the cervix. When used correctly, the female condom can be up to 95% effective and can increase the pleasure between partners. Diaphragm is another barrier method that needs to be prescribed by a doctor. It is 88% effective at preventing pregnancy, but can be most effective when used with other methods like spermicides or condoms. Some problems with the diaphragm include skin irritation, allergic reaction, or urinary tract infection. So what do you do if the method of birth control fails? First option is emergency contraception. Plan B, or the morning pill after pill, is used as a backup plan after engaging in unprotected sex. It can be taken up to 5 days after unprotected sex, but is most effective if taken before 3 days. Another option is abortion. Abortion is a deliberate termination of a human pregnancy during the first 28 weeks of pregnancy. If performed during the first trimester, there are little to no long-term physical or psychological damages. Of the abortion performed in the U.S. in 2011, 69% were because of economic hardship. 61% of women seek abortion already had 1 or more children. 18% were teenagers. 57% were in their mild 20s. Since its legalization, abortion has decreased to about 16.9% every 1,000 pregnancy. Overall contraception is key in order to prevent pregnancy. For those who are sexually active, there is 85% chance of pregnancy if no method of contraception is used. When used effectively, contraception can be 99% effective. Since its legalization, abortion rates have steadily declined. And lastly, the wider access to contraception has reduced the rate of unintended pregnancies and the need for abortion.